Hello friends, welcome back to Complete Medical Coding. Today I'm here with some guidelines for HIV and sepsis. Okay, this is an important topic for your CPC examination. You will definitely get some questions from sepsis or HIV. Sepsis and HIV, maybe both or sometimes at least from one of the topics. Okay, so that's what we are going to discuss it today. And let's move to the slides. HIV. What does HIV means? As you know, HIV is human immunodeficiency virus. Okay. So for HIV cases, if it is symptomatic, see I had done these slides more easy for you to understand it easily. Okay. So symptomatic, if there is a symptomatic HIV, you have to code B20. That's the default code for symptomatic HIV, and for asymptomatic Z21. Okay, so symptomatic B20. It means AIDS, HIV related illness and HIV infections. All AIDS, HIV related illness, for everything. If there is symptoms of HIV, you have to code B20. And if there is no symptoms of HIV, which means asymptomatic, you have to code Z21. Okay. Now, code only confirmed cases in OP and IP. So, for HIV cases, not only HIV, for all diagnosis, you have to code only if it is a confirmed diagnosis. Similarly, here also, in HIV, if it is only confirmed case, then only you have to code it. Okay, whether it is in IP or OP, whatever it is. Now, if a patient is converted from asymptomatic to symptomatic, then what will you code? Definitely you have to code it as a symptomatic, right? Means if there is no, if a patient which is admitted or if a patient which has been initially no symptoms of HIV, then later he got symptoms of HIV, of course you have to code the symptomatic one, okay? Symptomatic one, okay? Now, if a patient is admitted with HIV related illness, then sequence first the symptomatic HIV followed by the condition. Yeah. So if a patient is admitted with HIV related illness, some illness which is related to HIV, okay, then you have to code first since it is related to HIV, you have to code always first HIV, then you have to code the condition. Okay. But if the reason for the visit is unrelated to HIV, means if the reason for the visit which is not related to HIV, then you have to sequence first the current condition. Whatever the current condition the patient is having, you have to code that first, then followed by symptomatic or asymptomatic HIV, whatever it is. If it is symptomatic HIV, code HIV, otherwise no. Okay, so if the reason for the current visit is something else, but the patient is having HIV, so in that case, you have to always sequence first the current condition followed by the HIV code. Okay. Now, inconclusive serological test. That is the default code for inconclusive serological test R75. That is the default code. Okay, so in this case, the results are unable to predict. If it is an inconclusive, like if HIV is inconclusive, it means the results are unable to predict. Means once the test is done, they can't identify whether this patient is having HIV or not. If it is HIV positive or HIV negative, they can't identify. So in that case, you have to code inconclusive HIV, R75. That is the code. Okay. Up to 18 months of newborn, you have to code by default R75. Whether the newborn baby is either HIV or not, up to 18 months, you have to default code R75. Alright. Now, patient with inconclusive serological test but no definitive diagnosis or manifestation, code R75. Yeah, that's what I had mentioned earlier. Patient who is having inconclusive serological test and there is no other diagnosis, you have to code R75. Okay. Now, these are some few codes, default codes. for a screening of HIV, you have to code Z11.4. Screening for HIV screening, code Z11.4. HIV counseling code Z71.7. Counseling code it is. Okay. Test results are negative and patient returned to inform. Means the test results are negative. HIV is negative, but the patient returned to inform. Still, it's you have to use the counseling code Z71.7. Now, HIV related conditions. If it is an HIV related condition, code first B20 followed by related condition. And if it is unrelated to HIV, you have to code the unrelated condition first followed by symptomatic or asymptomatic HIV. As I had mentioned in the previous slide, these are the codes. Okay. Now, fractures. If a patient is admitting with fracture, you have to code initially the fracture code. Then code symptomatic or asymptomatic HIV. Okay. Now, during pregnancy, how will you code HIV? During pregnancy, patient is admitted with HIV related condition. Yes, see, always remember that if the patient is admitted with HIV related condition, code first the HIV related condition, HIV complicating pregnancy. Of course, since it is a pregnancy, you have to always code, the primary code should be O code, right? So, if it is an HIV related condition, code first the HIV complicating pregnancy, that is O98.7, followed by symptomatic or asymptomatic HIV, B20 or Z21. Okay. Now, some important terms for sepsis. Before moving to the sepsis, let's discuss some important terms. What is septicemia? As you know, septicemia means organism that is causing infection. Organism that causing infection is called as septicemia. What do you mean by sepsis? The presence of septicemia in blood that causes infection. The presence of that organism in the blood that causes infection, that is called as sepsis. Okay. Now, SIRS. What is the full form of his SIRS? Systemic Inflammatory Response Syndrome. Systemic Inflammatory Response Syndrome. Now, what is severe sepsis? See, three terms basically under sepsis you have to remember always. Sepsis, severe sepsis and septic shock. Okay. What is severe sepsis? Severe sepsis is the advanced stage of sepsis with acute organ dysfunction. So, advanced stage of sepsis with organ dysfunction, that is severe sepsis. What is septic shock? The third level of sepsis, right? Circulatory failure associated with severe sepsis and acute organ dysfunction. Yeah, that organ full failure, circulatory failure associated with the severe sepsis and the acute organ dysfunction. Okay. Now, post-procedural sepsis. What do you mean by post-procedural sepsis? Post-procedural sepsis. Complication that resulted after any procedure. Post-procedure means after the procedure. So, complication that arises after any procedure or the surgery which is resulted in sepsis, that is called as post-procedural sepsis. Okay. Now, two important synonyms you have to remember: MRSA and MSSA. MRSA means methicillin resistant Staphylococcus aureus. MSSA, methicillin susceptible Staphylococcus aureus. Okay, you might get under anatomy or terminology, you might get some abbreviations as well, or sometimes in the questions they will mention only the short form, not the abbreviation. Okay. Now, what is colonization or carriage? Colonization or carriage, MSSA or MRSA, that's organism. Okay, MSSA, MRSA is present in the body without necessarily causing illness. Without causing any illness, but these organisms are present in these Staphylococcus organisms are present in the body. That is what is called as colonization or carriage. Carrying that organism, yeah, without any reason, carrying that organism in the body. So that is called colonization or carriage. Okay. Now below are the few important codes just for your understanding. You don't have to by heart everything. Just for your understanding, I had mentioned all these codes. Okay. For sepsis, use A41.9. Severe sepsis, you have to use A40. This is the order, the sequencing order. Okay. If it is only sepsis, use the sepsis code A41.9. If it is severe sepsis, first use A41.9, the sepsis code, then R65.20, okay, R65.20, and then AOF. AOF means acute organ failure. So the second one should be the organism and third one should be the organ failure. Okay, so that is what is for a severe sepsis. So under sepsis, under sepsis it's only one code A41.9. Under severe sepsis you have to code A41.9, R65.20, and acute organ failure, if any. If there is any acute organ failure, you have to code that also. R65.20 represents severe sepsis without septic shock. Okay, and if it is septic shock, you have to use the septic code, shock code R65.21. So initially code A41.9. Okay, initially code A41.9 and then code severe sepsis with septic shock. Okay, so that is what and then acute organ failure, if any. That is what the order is. Now post-procedural sepsis. That is just an example. For example, some fracture or some, of course, the fracture, burn or something, some injury codes will come under T codes, right? So that T code should be used first because it is post-procedure, because of the procedure, and then code the appropriate sepsis code. And if it is with shock or without shock, say severe sepsis with shock or without shock. Now, post-procedural septic shock. If it is post-procedural septic shock, what should be the code? If it is post-procedural septic shock, you have to use first the T code, okay, and specified complication of the procedure, followed by the sepsis code, okay, and then T81.12, which means post-procedural septic shock. That is a post-procedural septic shock code. Okay. Anyway, these codes are just for your understanding how the sequencing should be. I had just marked it for your knowledge only. Okay. Now let's see the correct order, how the sequencing has to be carried out under sepsis, severe sepsis, and septic shock. Okay. So if it is sepsis, first you have to code septicemia code, the organism septicemia code. If there is no organism, by default you have to code A41.9. No, we cannot say organism, not specified, NOS, sepsis, not otherwise specified. Okay, so by default A41.9 is the sepsis code, sepsis not otherwise specified. Now, if there is sepsis with the organ dysfunction, it could be an acute organ failure or chronic organ failure. AOF represents acute organ failure, COF represents chronic organ failure. So AOF, if it is acute organ failure, if it is AOF related to sepsis, acute organ failure, yeah, of course, if there is acute organ failure, what you will code, which sepsis you will code? Severe sepsis you will code, right? And if it is chronic organ failure, COF with sepsis, then first code sepsis and chronic organ failure. Okay, so chronic organ failure with sepsis, then code the sepsis and then chronic organ failure. Okay. If acute organ failure is not related to sepsis, then what you will code? You don't have to code from severe sepsis, because severe sepsis means acute organ failure. Under severe sepsis, there should be an acute organ failure. So if there is no acute organ failure, don't code from severe sepsis. So if acute organ failure is not related to sepsis, then don't code from severe sepsis code. Okay. Now what is severe sepsis? In severe sepsis, always there should be two codes. Minimum of two codes is there in severe sepsis. The default code, as I told you earlier, A41.9, and then severe sepsis without septic shock code. Then if there is any acute organ failure, we have to code that also. Okay. So minimum two codes is required under severe sepsis. Code first the organism followed by severe sepsis. So always code first the organism under sepsis. If there is no organism, you have to code unspecified, not otherwise specified or unspecified organism, like that. So code first organism followed by severe sepsis. Okay. Now septicemia, severe sepsis, So this is the order. Septicemia, that is organism that causes sepsis, then severe sepsis code, and then acute organ failure if failed. That is the order. These are the guidelines for coding sepsis. These guidelines definitely you will get in interviews as well. When you go for coding interviews, medical coder interviews, you will definitely get questions from sepsis, especially if it is a hospital or if it is a big healthcare setup. Okay. Now septic shock. How will you code septic shock? This is the order. First code septicemia, the organism that causes sepsis. Then code severe sepsis with septic shock. Then multiple organ dysfunction. Of course, there will be multiple organ dysfunction, if any. You have to code multiple organ dysfunction, 1 or 2, whatever it is. Okay. Now, sepsis and severe sepsis with localized infection. Sepsis and severe sepsis with if there is localized infection, what codes you will code or what is the sequencing code? First one, if a patient is admitted with pneumonia and cellulitis, see cellulitis, it's a localized infection, and sepsis, then what you will code? Then sequence first sepsis followed by pneumonia. Always code first the sepsis, the infection, the sepsis followed by pneumonia. Okay. Now, another case, if a patient is admitted with pneumonia and after the admission he developed sepsis. So, initially patient admitted for or the patient is here to treat pneumonia, but then later he developed sepsis. So, in that case, you have to first code pneumonia followed by sepsis. Okay. That is what the sequence is. Now, same as discussed before, post-procedural sepsis. Always code first the complication. For post-procedural, after procedure or after surgery, in that case, you have to code first the complication followed by septicemia, followed by the organism. Okay, the complication or what complication arised, followed by the organism, septicemia or sepsis code. That is what is mentioned, T81.4, septicemia, followed by septicemia code, septicemia or sepsis code, okay. That is post-procedural sepsis. Now, what about post-procedural severe sepsis? Post-procedural severe sepsis, you have to code first the complication, followed by sepsis, and next severe sepsis. That should be the order. Code first the complication, followed by sepsis, and then next severe sepsis, okay. So, complication, as mentioned earlier, T81.4. Then, code sepsis code or septicemia, that is organism code, then followed by severe sepsis code. Now, what about post-procedural septic shock? Same as complication first, then septicemia, then post-procedural septic shock. That code should be used here, T81.12. For post-procedural septic shock, you have to code T81.12, okay. Now, next topic, sepsis and severe sepsis with a non-infectious process. What if it is non-infectious process, infection? It is not a serious one. It is not infected. So, sorry. In some cases, a non-infectious condition. What do you call it as a non-infectious condition? Such as a trauma, a burn, or a serious injury that may lead to an infection, which result in sepsis or severe sepsis. Okay, some cases, a non-infectious condition such as trauma, burn, or serious injury, such type of non-infectious condition can lead to an infection. It might lead to an infection which result in sepsis or severe sepsis. Okay. Now, R65.20, which represents severe sepsis, R65.21, which represents septic shock, should never be coded as principal diagnosis. Yes, this is not a principal diagnosis. What should be the principal diagnosis? The principal diagnosis is always the septicemia. Okay, either the complication or else the septicemia, the organism code. Okay. So, severe sepsis and septic shock should never be coded as the principal diagnosis. Alright. So these are the guidelines. Now let's discuss few examples from these guidelines. Okay. The first question. A patient was admitted with severe sepsis due to MRSA. So the organism is mentioned here. Okay. With septic shock and acute respiratory failure with hypoxia. How will you code this? So here a patient is admitted with severe sepsis due to MRSA. So initially the code should be A41.02. Okay, what is A41.02? A41.02, because it is here, it is mentioned the organism. So if it is a specified organism, you should not go for unspecified code. You should code always that specified organism. So A41.02 is sepsis due to MRSA. That is a code for that is a exact code. Sepsis due to MRSA, A41.02. Now what is R65.21? The second code should be, this is severe septic with septic shock, right? So you have to code that one. See, first the organism that you already got. Next you have to code the severe sepsis with septic shock. So R65.21, that is severe sepsis with septic shock. Now there is an acute acute organ failure mentioned, right? Acute respiratory failure with hypoxia. That you have to code as the third code, J96.01. So what is J96.01? J96.01 is what is mentioned in the question, acute respiratory failure with hypoxia. Okay. That's how you need to code. Similarly, second question. Patient was initially admitted and treated for an abscess of the liver. So it means what? Patient is initially admitted for abscess of the liver. And during the stay, the patient developed a hospital acquired bacterial pneumonia. So at the time of hospital stay, he developed pneumonia. So initially patient is admitted for what? Abscess of liver. So you have to code for that condition first, right? A06.4, abscess of the liver. Amoebic liver abscess. You have to code for the liver abscess. Then followed by the pneumonia. What he developed? The pneumonia. He developed pneumonia during the hospital stay. So that you have to code, unspecified bacterial pneumonia. It is not mentioned what type of bacteria. So you have to code J15.9, which means unspecified bacterial pneumonia. Okay. And then if the condition is originating in hospital, you have to code Y95. Y95 means, that is why it is mentioned in the bracket for you to understand. Nosocomial condition. Y95 represents a nosocomial condition. It means it's a condition which is developed in the hospital. A condition originating in the during the patient stay in the hospital. So that also you have to mark it. Okay. So that's how the sequencing is. Initially, the patient is admitted for abscess of liver. So code always the abscess of liver, the condition first, then followed by the organism. If there is no organism, code the pneumonia code. Okay, unspecified pneumonia code. Then code the condition originated in the hospital. That has to be coded at last, Y95. Alright. Now third question. Positive HIV test in a patient who is asymptomatic and has a high risk lifestyle for HIV infection. Yeah. So this is positive HIV test patient, but he is asymptomatic. He is HIV positive, but he has no symptoms of HIV. So asymptomatic HIV it is, right? So asymptomatic HIV code is Z21, as I told you earlier. Asymptomatic HIV code is Z21. Okay, so code that Z21, asymptomatic HIV, and then followed by, let's see what is mentioned next. The patient is having a high risk lifestyle for HIV infection. High risk lifestyle. That you have to code Z72.89. G72.89 represents, that is why it is mentioned in the bracket, I had mentioned in the bracket. Some problems which is related to lifestyle, like behavior, self-damage, lifestyle. Problems related to lifestyle, that you have to code. Okay. So Z72.89, problems which is related to lifestyle, that also you have to code. So asymptomatic HIV code first, followed by the what causes it is, what causes that condition, that also you have to mark always at the end. Damage lifestyle. Now, fourth question. A patient was admitted with AIDS related Kaposi's sarcoma of the skin. Related, HIV related condition, yeah. So a patient was admitted with AIDS related Kaposi's sarcoma of the skin. So it means it is an HIV related condition. So for HIV related condition, code always first the HIV followed by the condition. That is what our rule is, right? If it is an unrelated condition, code the condition first followed by HIV. But here, since the question is HIV related, AIDS related, so which means HIV related sarcoma. So code always the HIV related condition, HIV code first. B20, code B20 first, okay, followed by the sarcoma of the skin. C46.0. What is C46.0? Kaposi's sarcoma of the skin, as mentioned in the question. So this is how the sequencing should be. This is how you have to code. These are the guidelines. Okay, friends. So these are few important, not important, very, very important guidelines from sepsis and HIV. You will definitely get questions from this in your CPC examination. If you go through the CPC examination papers from each and every month, you can definitely find at least one question from HIV and sepsis. So please be serious about learning these guidelines. Keep in mind, this will be helpful, this will be useful in your entire career as well. When you go to interviews, see, I am having almost more than like 10 to 12 years experience in the same field as a medical coder. So that is the reason I am telling you, if you go for interviews, definitely they will ask sepsis question. Okay. So these are the guidelines. I hope you like this video. If you like the video, please like and share it among your friends. And thank you so much for supporting me. And thank you so much for all your subscriptions. Thank you so much for all your support. If you are new to the channel, please subscribe. Please subscribe and support me. Okay. Thank you so much, friends. Stay tuned. Bye. Take care. See you in the next episode soon. Bye.